Good afternoon, everybody. Thank you for joining us today for our TMC Mama Chat. If you have questions today during our conversation, go ahead and post those and we can answer them either during or after our visit today. And I'm going to welcome our lovely Stacy. She'll be chatting with us today. Hello. Thank you for joining us.
Thanks for having me again.
And then we also have Dr. Dean with us. Hello, Dr. Dean.
Hello.
So today we're going to have a conversation about a purposeful postpartum period and what it all entails. Just have an open conversation about some of the common things that happen and some of the things that can happen to complicate the postpartum period. So why don't we get started with talking about what a typical postpartum period looks like, some of the changes that are happening in our bodies and what to expect while we're here in the hospital and right after we go home.
Yeah, sure. I think that one thing I always like to tell my patients is that it took you 10 months to get this way, so it's going to take some time for you to rebound back. So when rebounding back, a lot of things are happening. Your body is changing and transitioning from all the changes that have happened to create to go through your pregnancy and create your baby. And so that includes your heart makes changes, your ligaments make changes, your muscles make changes, you hold on to fluid differently. And so all those things have to transition back. And then in addition to that, you have hormonal changes, your estrogen and progesterone levels are changing. And so, you may have temperature fluctuations, you may have some mood irritability and things like that. And so it also, just to let you know, to be patient with yourself. This is a learning process. You have to learn your baby and your baby has to learn you. And so that all just takes time. And time is what we have to recognize that we have to give ourselves grace to know that this is a process that women have gone through for thousands of years. And to be patient with ourselves and our body and recognize that we created a miracle. And that just takes time for our body to recover from those things.
Mm-hmm.
Thank you.
Sure.
Dr. Dean, I love that you said to give yourself some grace. I think as women and as new moms, sometimes that's really hard to do. So thank you for that gentle reminder. Some hot topics that have been in obstetrics recently are both the topics of pre-eclampsia, high blood pressure during pregnancy, as well as when there's challenges after delivery with bleeding too much, a hemorrhage, a postpartum hemorrhage. Yeah. And I think women who are preparing to come into the hospital for labor, those may be topics of concern. Do you have any helpful advice to kind of reassure the patients who are coming to see us about the care we can provide?
Yeah, I think that what patients can be assured about and comforted to know that we at TMC try to practice the recommendations by CDC of he or her, and meaning that if you're complaining about something, we're going to try to listen to you and we're going to evaluate you to make sure that those issues are not something that is of concern, meaning that if you have signs and symptoms of preeclampsia, because believe it or not, most preeclampsia occurs during the pregnancy and is resolved with delivery. But occasionally there are people that get preeclampsia in the postpartum period. And so if you get persistent headache that doesn't get better with Tylenol, really bad blurry vision, excruciating pain in the right upper side of your abdomen, like right underneath your ribs, then you should by all means let your doctor know. And then also, with bleeding, it is normal to have the normal phase of bleeding called lochia. And because your body hasn't bled for 10 months, so it does have to shed that extra lining that was there to protect your baby. But there is ramifications and or qualifications that are considered normal. It should be continuously starting to taper off and get less and less, ideally. However, your very first period may be somewhat heavy, but if you're soaking a pad an hour, you get lightheaded, dizzy, short of breath. If you're coughing a lot, then you should let your doctor know.
Absolutely. Yeah. I just wanted to urge viewers, Jordan and Dr. Dean, that we have completed a previous broadcast on some of those warning signs post-delivery. And we give a lot of information about the CDC's Hear Her campaign. So feel free to search for previous broadcast or go to the CDC's website and type in Hear Her in their search. And the good news is that if you come to our labor and delivery triage, for any reason, or are admitted to labor and delivery or deliver and postpartum, our highly trained nurses are going to give you a lot of good teaching, as well as handouts to take home, including the CDC Hear Her information.
Dr. Dean, you touched on a lot of things that happen during follow-up appointments. So, making sure the blood pressure looks good on a patient and making sure mom is within the boundaries where she's supposed to be in that postpartum period. Can you talk a little bit about why it's important to keep those follow-up appointments? And, you talked about warning signs when mom should reach out, but how important it is to keep those follow-up appointments and what that can prevent.
Right. Well, what you want to do is make sure you follow up, because there are things that your clinician will look at and recognize that you may not necessarily recognize, and or think, well, that's the way it's supposed to be. And we may say, no, not really. Like I said, we check your blood pressure. We look to see about, make sure that your uterus is contracting down the way it's supposed to be. Make sure that your incision site is healing well. Making sure there's no sign of infection. Taking a look to make sure that your cervix has healed and recovered appropriately. Making sure if you had any tears or lacerations or episiotomy, that those things have recovered. Making sure your mental status is stable. And so those are a lot of things that we touch on. We talk about birth control. And we also always encourage you to try to abstain and wait to have intercourse until you've been seen by your physician and they release you and say that you're okay to have intercourse. Because if you have sex too early, you can cause yourself to be more likely to get an infection, because that vascularization is more porous and you're more likely to get an infection, and you can get something called endometritis, which end up causing you to have to get readmitted and be away from your baby, and just becomes a insurmountable issue. So it's very important to follow up, and it's normally not a very long visit, but it's a very important visit.
Yeah, and I feel like there's a lot of information that gets shared when you're being discharged from the hospital, very important information, and some of it can get lost, if you've got, you're tired, you're hormonal, you've got a baby you need to nurse or feed, and some of that information might slip by and you might forget. And I've had, times when I'm talking with a patient and I say, do you have headache or any of these symptoms? And they're like, you know what? I actually do have a headache that won't go away. Or, I really do have that. So working as a team and having those reminders and kind of just reminding you, making sure we're keeping you safe.
Yes. And I just would like to add that sometimes patients that have had maybe some blood pressure issues, either a history of them or had pre-eclampsia during the pregnancy, we may ask them to come back a little earlier, not just for 6 weeks. We may say, come back in a week and check your blood pressures. And I have had on more than several occasions patients that I have to send back in, and they have to get a medication to help them because they're developing signs of pre-eclampsia. They may not have had pre-eclampsia even during the pregnancy, but for various reasons, or they develop congestive heart failure and various things that can occur that you may think that, oh, well, this is just my body changing. And sometimes it is just your body changing, but your clinician will be more astute into recognizing that those are issues that need to be addressed so that you can get better care and we can make sure that you're okay.
What a great discussion. I think something that we see on message boards a lot, and sometimes here in our childbirth education classes, are the expectations and challenges a mother may have as she's adjusting back from being pregnant to getting discharged from the hospital, now caring for herself, caring for her infant, maybe caring for other members of her family. And as we talk about that grace, what is some great advice for maybe self-care, bonding with baby, family, getting good sleep and nutrition? What tips do you have for us, Dr. Dean?
So what I try to implore with patients is try to, if you can, not all of us are fortunate enough, but if you can help to build your support network before you even deliver. Studies show that a lot of women that develop postpartum depression and or psychoses or anxiety, is because they have a limited amount of support. And if you can develop your friends and say, listen, I would really appreciate when my baby comes, I may need some help a little bit, just so you know. And you're not a bad mom if you take a break. Actually, it's really good for you to take a break. An hour or two will do you world of good. Say, you know what? This is my good friend Susie's next door neighbor. She's gonna watch the baby for a couple hours. I'm gonna just take a nap, or I'm gonna get my nails done, or I'm gonna read a book for a minute, or just do you for just a little bit. It helps you to balance things, and life becomes about balance. And also recognize that your baby's only mechanism a lot of times of communicating is crying. And so some babies will be colicky and some babies will cry a lot. It doesn't mean that your baby doesn't love you or anything to that nature. It's just one of those things that's your baby's way of communicating at this stage. And so they're trying to let you know that, but if you know that you've fed them, they're not wet anymore, or they're not soiled, you've burped them, you've done all those things, you can cuddle and love on your baby. Some of them are just a little bit more irritable than others, and it's just a transition process. This too shall pass. So be kind to yourself, and recognize that being kind to yourself and imploring other people to help you is great. If the dad is involved, let the dad show them. A lot of times, we think we are the only ones who can do it right.
Yeah.
And that's, I'm a perfectionist, so I get it. But I think that we have to just show the dad, okay, now, honey, this is what you want to do. This is how you want to change the diaper. You want to make sure you wipe the baby's bottom really good, and and put the Desitin cream on, or whatever the case may be, and train them up, because we have to kind of nurture them into that process as well, but empower them to let them know, you can do this too. And then you step away. It's not like you do it, but you're not looking over trying to make sure you're doing it all right. It's like we say in medicine, each one, do one, see one, teach one. So you do it, let him watch you. You let him do it. You watch him while he does it, and then you say, okay, now it's on. Now it's your turn. Sometimes you get to change the diaper.
Yeah, and then also give a little grace. Take a little grace for yourself, and give that other person who's helping you some grace.
Yes, exactly. It's all about teamwork. Teamwork makes the dream work.
I love it. Yeah. Such a great reminder, and also very inspiring. That's awesome.
So we talked a little bit about the warning signs, when to reach out to your OB if something seems off. And a lot of times, you said, with preeclampsia, or anything can happen after your 6-week checkup if it's a C-section, or after your 1-week checkup for a vaginal delivery. There's things that can happen after that. It's not like magically everything's going to be perfectly fine. So if a mom notices something's off after those visits, how should she reach out to be seen then? And then also, when she's pregnant, how should she reach out to get some help from your office?
Yeah. Well, she can always call the office and let us know her concerns, because then we will know to allocate. We'll either add her in for a triage visit. Some things can be handled by your primary care doctor occasionally as well. And or sometimes we'll say, with this condition, you need to go to the emergency room, or you need to go, we'll send you to triage sometimes still as well. So it really depends. But if you feel like something is not right and your innate sense tells you that, listen to your body, reach out and call us. Sometimes we can reassure you and say, that's normal. But it doesn't hurt to inquire. If you wonder, let us know. And we're the professionals. We do this day in and day out, and we'll direct you in the right path.
And then also, like we said, having that support person, in tune with you. If you have somebody like that, then if you're the support person, say something, say, hey, you seem a little off, or maybe we should call your doctor. Sometimes I feel like as a mom, you need a nudge, because you don't want to, you might be in denial a little bit. You need a little nudge, something does seem off. You should call. That it's okay to do that for yourself.
Absolutely. You can't, it's like on the airplane, when they say that if the oxygen falls, you got to put it on yourself first before you can help your child. Same thing. You got to take care of yourself first, so you can take care of your children and the rest of the family. So in tune with yourself.
Absolutely.
Thank you. Did either of you had anything you wanted to discuss further or add to the conversation?
I would urge all of our viewers today to check out some of our offerings online under our TMC for Women webpage. We have a free class that's available to the community on healthy pregnancy. So if you're thinking about planning a family or you're already pregnant, a great class to take out. We also have a lot of different offerings for preparing yourself for childbirth with your significant other. We have support groups for after you deliver to address all the emotional needs that come with being a new mama. So please check out our offerings. We want to continue to support you not only while you're pregnant, but after you deliver here at TMC.
And thank you. Dr. Dean, Stacy, thank you for joining us today for our conversation.
Glad to do it. Thank you.
Thanks, everyone. Thanks for tuning in.
Thank you for joining us today, everybody. Here's my contact information if you're interested in any of our classes that we have available here. You can visit the webpage below or my phone number. Feel free to call me. This is our last episode of TMC Mama Chat. We will have a new series coming. It'll be the Pediatric Grow Well series starting in August. So be on the lookout for that. If you have any questions, please post those and we'll get back to answer them. Thanks. Have a good day.